time of the lecture, we don't ask the questions. After the lecture, I will finish in 5 minutes earlier, and it will be enough and more enough time to ask me all your questions. Now, write your question, do not forget. And listen, please. Region of phase. First of all, as usually, we must understand division of phase region and parts of the phase region. Let's remember first of all, big division of the head into facial and into cranial parts. It's simple, you remember. From nasal, supraorbital margins, superior margins of zygomatic arch up to external acoustic nerves. In front of the line and below line, we have phase. Above the line and behind the line, we have the cranial. Great. Now in its turn, remember, phase is divided into medial and lateral phase regions. Yeah? Now look to me. All the part of phase which is below your infraorbital margins and between two natural folds, once again, below your infraorbital margins and between your natural folds, which natural fold? Nasolabial, labiobuccal. These folds we call, remember please, medial phase. Let's say in medial phase we included your orbits. In medial phase we included your nasal, oral, and mental regions. Let's say once again, orbital regions, double. All another regions is single, nasal, oral, and mental. That is medial phase region. Now, laterally to these imaginary folds and below your zygomatic arch and infraorbital margin, here you have lateral phase. This is lateral phase region, borders, look here please. From upwards, infraorbital margin and zygomatic arch. From down, it is inferior margin of your mandible. From in front, it is natural folds. From behind, it is posterior margin of vertical process. Thank you very much. Let's say, remember forever, please, this is lateral phase. Write the name of topic, lateral phase region. And write, please, this lateral phase divided into two compartments.
Superficial and deep.
Very well, thank you very much. Superficial and deep. And what is the division between them? Two bones, guys. Look here, please. Vertical process of your mandible and zygomatic arch. Now, everybody, attract your attention into this picture. What do you see here? Vertical process and zygomatic arch is removed. And under of these bones you see soft tissues, which is called deep phase. Let's say once again, remember forever, border between superficial and deep lateral phase, it is two bones. First one, it is your zygomatic arch. Second, it is vertical process. Third structure, it is muscle. We call it masseter muscle. Inner surface of masseter and inner surface of these bones located in the same level. Let's say deep phase located 1, 2, 3. You will be zygomatic arch, you will be vertical process, you will be masseter. Deep phase located behind of them. Behind of zygomatic arch, behind of the vertical process, behind of the masseter muscle. And vice versa, superficial phase will be in front of two bones and in front of the masseter muscle. In front, I mean superficial. Idea is understandable for you or not? Very well, now write please, superficial lateral phase region. Superficial lateral phase region. And look to the second picture. Again, we understand that superficial lateral phase located superficially to these three structures. Now, in the picture, I draw it by two colors. By light brown and dark brown. And light brown we call buccal, Dark brown we call paratidomasseteric. Let's say right, please. Superficial lateral face divided into buccal region and into paratidomasseteric region. What the border between them? Now look to me. I will close now strongly my tooth and will little bit press them. Look to me.
Yes.
You see my masseter muscle?
Yes.
Anterior margin of this masseter will divide these two regions from each other. In front of anterior margin we will have buccal region, behind of it we will have paratidomasseteric. Let's say once again we make conclusion. All face we divide it into superficial and deep portions. Superficial portion we divide it into buccal and into paratidomasseteric portions. Remember it, please, and write now the name of our topic, buccal region. Again, friends, let's understand each other. I remember I had very famous teachers, very famous teachers. And till now I remember what they teach me in the time of my education. And I have one very famous professor, Zavadsky. He said that doctor only help the patient. Doctor doesn't treat the patient. Patient must treat himself by help of the doctor. And I think now I come to conclusion that teacher in the university have reasonable response. I don't teach you. I just only help you. You must teach yourself self-independently. That's like if you don't want to teach yourself, if you don't want to study self-independently, no any teacher will not help you. Believe me, if instead of me now will be Albert Einstein, also nothing will not be changed for the person who don't want to study. So it's not important how prominent professor is teach you in case if you don't want to study. In case if you want to study, of course it is very important. That's why, guys, why I start to speak about it, because that is impossible to introduce all the topic sentence by sentence during the lecture. So I want again to say that now I will attract my attention into the most important problems, which you should know. It will be the base of all these region topographical anatomy, but it will not be all the structures. All another questions, I spent huge of the time to create these slides, to put the necessary pictures. You must find self-independently. And let's start. Don't write anything, just mainly listen to me, please. First layer, it is the skin. In buccal region, as I told you before, we have one of the most elastic, movable skin of the human body. What it means for the surgeon? For the surgeon, it may make the work in this region very simple. From this point of view. Why? Because you don't have any problem to connect the margins of the wounds and to apply the sutures. Also, you understand that you can make not so, for example, near the suture steps, because the margins will be very good grip to each other, even if you will apply it. But don't forget that skin sutures here has great cosmetological effect. I told you yesterday that I ordered the suturing material, and in next week I will show for you what does it mean cosmetical sutures. Here we try to apply the sutures, guys, without perforation of the skin surface. You remember I told you we work inside of the thickness of the skin. Let's say, remember please, if for all another regions cosmetological problem is secondary for us, in face region it is primary problem. So you will attract your attention into the cosmetology. Fortunately for us, guys, healing and regeneration in buccal region is very rapid, fast. You know why? There are three main reasons. Reason number one, as I say you, very elastic and movable skin. And you remember the general rules of connection and disconnection. If two same tissues firmly attached to each other, it gives the great regeneration. Problem number two, why this region is so rapidly regenerated. It is great vascularization. You will not find any other region of human body with so good vascularization. That's why some students, today it is very seldom, emotionally can change even the color of the skin. Yeah, if you do something bad, usually your skin is colored in red. Vice versa, inside of some emotional stress conditions, it can stand pale. Why? Because this vasal reaction visible for us. There are so many vessels under of this skin. More of this skin is thick. Skin is not so thick. That's why you see vasomotor reaction under the skin. That's why, remember forever, the more vascularized the region, the better will be regeneration. I think it is very simple. Point number three, why in this region we have so good regeneration, huge innervation. Don't forget, friends, you can take your bags and go out. Where you come? Take and go. Goodbye, friend. Normal. Good luck. It is confusing, guys. That's so huge, big person. Don't understand what he do in this university.
He is sick.
Huh?
He is sick. Yesterday we talked.
Do you remember yesterday's situation also? He go out and after half of hour only come to the lesson. He tried to check my patience. I don't suggest to anybody to check how patient am I. Don't do. Yeah, I say for you, there are only one type of the word to each other. It is great response. I must have response to you, you must have response to me. If we will destroy his attention, it will be bad, first of all, to you. So I don't suggest to do it. More of this for adults, it is unacceptable because we are normal, polite persons. And we will show that we are from normal families. I think it is normal. Let's continue, my friends. That's like three reasons. But you can say, and how innervation influence into the... Don't forget that your tissues supply not only by vessels, but by nerves. Then you cut the nerves. What is happened? Dystrophical processes in the tissue. Try to cut, for example, nervus ischiaticus, and to see what will be with the muscles of the lower extremity. After 1-2 months, all muscles will be constricted and they will be deformated. We will see deformation, hypertrophy of the muscles. Let's say nerves provided the trophical processes as the vessels for the soft tissues. This is three reasons why here regeneration is so good. Now let's finish to speak about skin and to come secondly, which is called fatty tissue. Generally, guys, you see, beautiful small children has very good developed cheeks. Yeah? Why? Because fatty tissue is good developed in childhood, especially during first 3-4 years of the life. You know why? For sucking of milk. For milking, friends, the wall of oral cavity should be thick. Because child must make negative pressure inside of oral cavity for drinking of the milk. Yeah? Otherwise, we will have something which I will show now for you. Walls will be attached to each other in case of negative pressure, yeah? And milk drinking will be impacted. Friend, now you just check my patience.
Doctor, he need help because
I can
that's
help
creation.
you. Go help me. Excuse me. Friends, I have very serious problems in my life, up to the serious vascular problems. But I don't show it so emotionally as your friends show small situatable problems. You're not the showman, friends. Don't make the show. The man should be strong. And even the problems will not be so. I don't think that he need now emergency treatment. Okay, let's continue. That is his response. Let's have a look here, please. Fatty tissue. Remember, please, in the childhood, it is great development. Why? Now attract your attention into this yellow structure, which you see in our region. Do you see it? What is it? Fat. But it is unusual fat. Inside of subcutaneous fatty tissue, in the central portion of it, there are part of the fat which is surrounded by superficial fish. Superficial fish cover some part of the fat and make the capsule for the part of the head. You know why? Remember, please, encapsulated structures has little bit not so good developed vessels and nerves, yeah? Because they cover by the capsule. And who can tell me why it is necessary to reduce little bit supplement of this central portion of the head? Huh? To not give for this fat possibility to be reduced. Now look here, if you make the trainings, sports, you lose your fat, yeah? But not from this portion. Let's say for the children, even if they will not have good feeding, this fat will be loosed only in last term. All another fats will be loosed much more quicker than this fat, which is covered by the capsule, because encapsulated fat doesn't have so high metabolism. Do you understand me? Metabolical reactions here will be the low. What is happening? Right. What is happening? Let's go over.
نازل ليش امبارح؟
لا تاني بيديروا كورس.
المستشفى.
يلا.
Let's continue.
So there is no much vessels surrounding this.
Friend, I understand. There are the problem. We are all doctors here. That's why he can come to us and we will be glad to help him. But believe me, even the stroke and infarct doesn't so influence our health to be fall down in the floor. They say you will keep little bit yourself strong. I understand we have the pains, we have the problems, but we are men. Let's continue. That's why once again, friends, this fat, it is different from another fats because it is surrounded by the membrane, by superficial tissue. And remember, please, we call it Bichat's fat. Bichat, it is French surgeon who first described this fat. We call it Bichat's fat. Bichat's fat, as I say you, great develop in the child. This Bichat fat should be fixed inside of fatty tissue, should be not moved. For that, Bichat fat has 3 processes, which is passed to the neighboring regions and fix the Bichat fat in its place. Remember the name of these processes: processus orbitalis, processus temporalis, and processus pterygopalatina. I will explain now the passage of each one. Let's start from processus orbitalis. Unfortunately, I don't take today the skull. In our practical class, I will show you. If you will insert it your finger behind of your, no, don't do it. You can't, don't do it. If you will insert it your finger behind of your zygomatic arch, you can palpate it one fissura, which is connected place under zygomatic arch with your orbit. We call it fissura orbitalis inferior. You remember there are 2 fissura orbitalis, superior, which is connected with cranial cavity, and the inferior, which is connected with deep face. Why deep face? Because under zygomatic arch, 2 minutes before we say, we have deep face. Deep face located under 2 bone and under 1 muscle, 2 bone, 1 muscle. That's a fissura orbitalis inferior communicated your deep face with your orbit. What is happened with this process? It is passed behind of zygomatic arch and by fissura orbitalis inferior enter inside of your orbit. Imagine situation. in your age, it's very usual to have inflammations of the skin. Yeah, furuncles, carbuncles, hidradenitis. If you, by dirty fingers, you will press it, part of the pus can goes to Bichat adipose mass, and by orbital process can be spread it to the orbit. From small problem on the skin, you will have huge inflamed orbit. Don't be confused and understand that it passes by direction of processus orbitalis. Process number 2, again pass behind of your zygomatic arch, but strongly vertically come
Temporal
to your
fossa.
temporal region. Hamza, yesterday, you remember, we speak about deep, loose connective tissue. You asked me, yeah, about subaponeurotical loose connective tissue, which is called fossa temporalis. Let's have a look here, please. This part of your deep face, which is under zygomatic arch, we call fossa infratemporalis. Depression, which is above your zygomatic arch, we call fossa temporalis. Let's say fossa temporalis and fossa infratemporalis behind of zygomatic arch communicated to each other. Let's say this fat behind of your zygomatic arch goes to subaponeurotical fat or fossa temporalis and fixed here. Last process from clinical point of view is the most dangerous one. Now look in the picture,
You go by the time.
which we call pterygopalatine fossa, by the way. Now look here. I will little bit enlarge this picture to make it more visible for you. 1 minute I will find the best picture which is show this problem. For example, this one. This is good. This is great. Now let's close the slideshow and let's maximally enlarge this picture. By the way, guys, resolution of all pictures which I use is very high. That's why you can simply enlarge it how much, how you want. Usually I decrease the size because I don't have so much place, yeah? But you can enlarge it simply. Now look please here. Do you see this most deep part of deep face? We call it fossa pterygopalatina. Remember please, deepest part of deep face we call fossa pterygopalatina. What is the borders? Look, from in front it is maxilla, tuber maxilla. From behind it is pterygoid process of sphenoid bone. And from behind. And in deep we have vertical plate of palatine bone. Let's say this is maxilla, this is pterygoid process, and this is vertical plate of your palatine. Your palatine bone has vertical and horizontal. Horizontal forms the roof of your oral cavity, or it forms the floor of your nasal cavity, yeah? Yes. Together with the palatine process of the maxilla, your hard palate forms by two bones. Anteriorly, it is palatine process of maxilla, posteriorly, horizontal plate of your palatine. Now look here, please. Look, friend. In this vertical plate of palate bone, like this small window, there are aperture, which we call foramen spheno-palatina, which is make communication with deep face with nasal cavity, behind the nasal cavity. Why I tell you now about it? Last process, which we call processus pterygopalatina, pass behind of zygomatic arch and goes to the deepest part of deep face, which is called fossa pterygopalatina. Why I say it is worst process? Because if infection will be spread to fossa pterygopalatina, 80% of cases mortality. You know why? 3 apertures will be in front above of me. Foramen rotundum, foramen ovale, foramen spinosum. By each aperture, infection can go to the cranial cavity. I told you meningitis, encephalitis, and thrombosis of the sinus. Let's say, remember, please, guys, don't make such kind of stupid things in your face. Last time I told you, even if you have any infection, it is forbidden to be pressed. You will take sterile needle. You will puncture it. Firstly, you clean it using antiseptics. Then take sterile needle. Then perforate it. Then only make the pressure to remove the pus, and after you apply antiseptics. This is only correct way to treat any inflammation. Why? You make communication with outside. If you don't have communication, after the pressure, there are equal possibility or to push the content to inside or push the content to outside. And if it will come to inside, you will see so big problems will be happening. Now listen me attentively. What except this fat we have inside of fatty tissue? 2 minutes before I say you that we have huge amount of vessels and nerves. Very many vessels and nerves. And little after I will tell you about it. What else? In fatty tissue, except these vessels, except Bichat muscle, we have your impressional muscles, which you use to show your emotions. Exactly here we have musculus orbicularis oris, musculus zygomaticus major and minor, musculus levator labis superior, musculus levator labii inferior. All these muscles, guys, partly musculus orbicularis oculis also pass to downwards. Let's say this is impressional muscles, all of them located in fatty tissue. Now, friend, you are my good student. Remind me, please, what is difference between skeletal muscles and mimical or impressional muscles? Both has striated muscular fibers. Both can be regulated by our consciousness, yeah? Comparable with the smooth muscles, but they have difference.
Between skeletal muscle and impressional muscle.
No, I don't say difference in function. I ask you difference in structure.
Do they connect to the skin?
So good answer.
They
So good answer. Let's say skeletal muscle from two sides should be connected with bone. Let's say then skeletal muscle will be constricted, your bone will change position. We call it flexion, extension, yeah, rotation, abduction, adduction, something else. Our skeleton changed somehow position. He is absolutely right. For impressional muscles, we have two other possibilities. Or it is fused with the bone by one side, or it doesn't fuse to the bone at all. And located inside of the fatty, like your platysma, doesn't have any attachment to the bones. It's located in the fat. Let's say, remember, please, your impressional muscles located inside. There are only one exception. This is musculus buccinator. Musculus buccinator, it is impressional muscle, but it is attached to the maxilla and mandible, and it forms the lateral wall of your oral cavity. All muscles which I mentioned, except buccinator, covered by superficial fascia. Buccinator muscle covered by deep fascia, like the skeletal muscles. But deep fascia cover the buccinator only from outside. From inside, what? That's why, guys, remember, these muscles have specificity of innervation. Can you say, Natalie, which specificity of innervation this muscle should have? Usually your muscles have which kind of innervation? Motor. This one have a motor and sensory, because from inside it covered by mucous membrane. Mucous membrane should have the sensory innervation. Let's say, remember, please, you will listen the name of two nerves. One we call just musculus buccinator. It is from mandibularis, third division of. Second we call ramus buccalis nervi facialis. I want to remind you that all your impressional muscles, all innervated by nervus facialis. Don't forget that your facial nerve inside of your carotid gland. Look in this picture. That is greatly visible for you here. Look, everybody here. What do you see in this picture? You see essansarinus major. Nervus facialis by foramen stylomastoideum come to outside, gives only one sensory branch, posterior auricular. We studied together. Yes. Then it is enter inside of your carotid gland, and firstly gives the two branches. Upper divided into 2, lower into 3, and 5 branches we call pes ansarimus major. Ramus temporalis, ramus zygomaticus, ramus buccalis, ramus marginalis, ramus oldi. If I will put my tenor in my fossa retramandibularis and maximally open my fingers, they will show projection of each branch. That's why remember, please, my middle finger will be called ramus buccalis. Nervus buccinator, it is sensitive. Ramus buccalis nervi facialis, it is motor. Do you understand it or not? That's why remember, please, once again, let's make conclusion. In fatty tissue, we have Bichat fat, we have vessels, and we have muscles. Of course, together